Shobana?
Can you hear me now?
Yes, I can hear you. I can see you as well. Great. So we have a face now. Hi, Ava.
Hi, Raman. Hi, Shobana.
Is my name displayed in the thing or?
Yes.
Okay.
Raman, would you want to project the presentation or?
I'll just do that.
Okay.
I'll just do it. Is it visible?
Yes.
Should I put it full screen?
Yes.
I think we should start now, I think. Or we should wait for some more time, 3 more minutes for people to join.
I think we could wait for 2 more minutes.
Okay.
I see that the participant number is increasing.
Yeah. So for US people, it is 6 o'clock in the morning, no?
Yeah, I think it might be difficult to have.
Ava, your face is not coming properly. Probably you need to adjust your screen or camera, whatever. Yes, better. Yeah, great.
It's midday in Europe, so I think from the European side we shouldn't have any problems.
In India, it is 3:30 now. 3:32 exactly. I could manage my other meeting 3 minutes before.
That's great. Yeah, I think we are now flooded with virtual conferences and meetings.
Yeah, I just was finishing a presentation on equity and inclusion. How did we supported the sanitation mission in India?
That's great. So I think we're ready to start.
Yeah, we will start now. Do we have Kanika? Is she in?
Raman, are you able to hear me?
Yes, Kanika, loud and clear.
Okay.
Thank you.
All right. So, early good morning, good afternoon, early good evening, good evening. I hope there is no one who is in the night time here. So, welcome everyone and hello. And I am Raman, and I am speaking from India, sitting in the WaterAid India office of Delhi. And I work with the WaterAid India, and I head the policy vertical of WaterAid over the last 4 years. I'm coming from a public health background otherwise, and working on health and linked themes for over some 20-25 years now. And so I'm very glad that we are having this talk about this invisible links, but the kind of moving force for the sanitation, entire sanitation work. Not only work, I mean, it's all about sanitation, so sustainability, the visibility, the overall life of sanitation is the sanitation workers. So we are here to discuss some of the very critical issues about the sanitation work. And so some of the critical issues that we are going to discuss today we will start with a very brief kind of check of how much we understand the issue of sanitation workers in detail. So that will be the start, and then we will go into 3 presentations, and we will have an opinion poll on 3 typical topics around sanitation workers today. And these topics are: one is policy and regulation and SOPs, that is the first topic for the sanitation workers and their welfare. Second is evidence and research on this very important topic, and third is advocacy and empowerment. So we have classified this into 3 groups, and we actually thought we will have a breakup session, but for some reasons we could not do it, so we converted it quickly yesterday into this. To take your opinion, to take your inputs, we will use this poll into something of a crowdsourced kind of knowledge gathering exercise. So all of you are welcome for that. And then we will have a conclusion by the colleagues from FSMA, and we will also have some important information that is coming on the FSM 6 conference, which is upcoming. So the session, we will focus on the workforce of the sanitation chain. I have already told, and they are very critical to achieve safely managed sanitation. And in different countries and different settings, their problems are different and their prospects are also different. We need to see how to address their problems, and also how to enhance the prospects and strengths of how they are working, their working conditions, their social security, and various other things. So and we will discuss the global practical experiences, also some of the national experiences today. So we have a good gathering of presenters and discussants. So may I now request Shobana to take over to conduct the very brief sanitation worker quiz. So that quiz, let me introduce Shobana. Shobana is a ward specialist working for over last 7 years on the various issues of school wash, capacity building, emergencies in sub-Saharan Africa, and all that. And she's currently working as the ward specialist with BORDA. And Shobana, over to you for describing the quiz processes and to put up the questions so that people can participate. Over to you, Shobana. Thank you.
Raman, could you just move to the next slide so that they
I'll
would
do
be
that.
able to
Yes.
see the code? Yeah.
Yeah.
So just to start off and get you all in the mood, we prepared a small quiz on sanitation workers. It's a very simple quiz. I would now request all of you to take your smartphones or log on in your laptop at www.menti.com, and then you can use this code.
Everyone, I request, please, pick up your phone as Shobana is suggesting. Yeah.
And type in the code that's on the screen right now. So I think most of you have already logged in. So I'm going to start the quiz, but maybe just giving you a couple of last seconds so that you can log in.
Yes.
I see a lot of participants here.
Yes. Please give us the code again.
The code, can you see the screen? It says www.menti.com, and then use the code 3154082. You can see it on the screen now.
Okay, yes. Let's see. Thank you.
3154082. And
Yes. Thank
so let's go ahead.
Move the slide.
Yes. So you have 12 seconds to answer. Based on the type of labor, could you name the most laborious pit emptying method? Okay, so we have answers like manual scavenging, manual emptying, guy with a bucket. I think all of you are right. Yeah, the correct answer is manual emptying. Now off to the next question. Which one of the following is not a mechanical emptying method? So you have vacutug, evac, scooper, and gulper. Which one is not a non-mechanical emptying method? And time's up. Oh, well, not bad. 19 of you have answered correctly. Scooper is not a mechanical emptying method. It's a manual scoop that you use. It's something like a shovel that you use to pick sludge that is really wet because it has a container or a vessel. Over to the next question. Oh. What does PPE stand for? And you have 30 seconds to answer. PPE. We had some really interesting answers last time we did this quiz, so I'm expecting some funny ones too. All right. So we have personal protective equipment is the right answer, but I think we received people, places, ecological, and some spelling mistakes, which I think we can pardon. But quite a lot of you have answered right. Most of it is like different versions of spellings. I think someone got personal wrong and then equipment wrong. So maybe we'll have an English webinar next time.
It is also because of the mobile phone.
Yeah, that's right. I know it's really I make a lot of mistakes when I type on a mobile phone. Over to the next question. So arrange in the right order the PPE from head to toe. So what starts from the head and what ends in the shoe. So you would have to arrange based on the options that you see. From head to toe, so from top to bottom.
Hey.
So the correct answer is helmet and then goggles, and then you have the face mask for your nose and mouth, and then overalls, gloves, and boots. Someone did manage to get it right. So we'll see the results in some time. So what do you think is the biggest challenge or obstacle while emptying sludge? So put yourself in the shoes of a pit emptier or a ground practitioner, and what is the biggest obstacle when you either do manual or mechanical emptying? Yeah, I see a lot of answers. Um, well, the right answer here would be solid waste, because most emptiers describe that solid waste creates a lot of problems. It's really time consuming to separate solid waste from the fecal sludge, and most of them do not get paid for working overtime to remove solid waste from the sludge. But I do see some other very interesting answers like sharp objects, poisonous gases, dilution, transport itself, and human contact with waste and smell. I think they're all correct answers in one way or the other. So we have the leaderboard now. And so the winner of the quiz is Jeanette. And then the second person is Boti. So congratulations. Janet, would you like to briefly uh, let us know a few words about yourself? Are you able to speak? Could you quickly switch on your mic and say a few words?
Hello, I'm Jeanette.
Hi, Janet.
I am in Pietermaritzburg in South Africa, working with Partners in Development. We are the developers of the eVac, so I've been working on that emptying device and done some work with training of sanitation workers.
That's great. Thank you. Thank you so much for introducing yourself. So the second place was Boti and the third was Jennifer Williams. So congratulations, all of you. Now over to a very short opinion poll. I just have a few questions. Sanitation workers as the topic was discussed really promptly and predominantly. This topic kept appearing in several presentations during the FSM5 Fecal Sludge Management Conference in South Africa. So we have some learnings from that conference, and let's collect your opinion on us on certain topics. So if you're still on Menti, if not, just please log in and type the same code again. What is your opinion on local authorities or the government benefiting from private sectors? Do private sectors play a very important role in service delivery when it comes to non-sewer sanitation? I think predominantly people do agree that privatization is to a certain extent helping. I see that some people have responded maybe, which means that the situation is still unsure because of probably because of the private sector and public sector partnerships that exist. But we predominantly have, most of you believe that privatization does help. So from FSM5, what we learned that private sector collaborations really do help achieve citywide service delivery, provide additional skills and capital investments and innovation, because as private sectors are able to invest more in different innovations, they do help develop sanitation as a profitable business. Thank you for the likes. Yes. So what do you think is the condition of sanitation workers in Asia and Africa currently, according to you? So I predominantly see that it's either pathetic or poor. So we definitely acknowledge the fact that this topic needs more prominence in the sector, or we're also happy that it is gaining prominence now with respect to dignity and safety of the workers and also their labor regulations. I think that is exactly why we are here to discuss more about this issue. So yes, so from FSM5, what was discussed was there is definitely stigmatization in the society, and there is unsafe, terrible working conditions and probably improper pay, and most of them are not given formal training, and it's considered a very informal business, and the service chain often overlooks the ground practitioners, and we don't really talk about them so much because it still exists as a taboo in several countries. So the next question is, how can we improve the condition of sanitation workers? What do you think could be done to improve the situation? So you have some time to type your answers. We see some words coming. Most of you mentioned proper regulation, and then better recognition, make sure they have PPE, and then make sure that they are formalized and recognized, and they have health safety training, better conditions, and somebody has mentioned standard operating procedures. Formalization and recognition, regulation keep cropping up again. So training, recognition of these professionals, and formalization of the non-sewage sector itself is really important to make sure that we improve the conditions. So we can see that according to the discussions from the FSM5 conference, they say that there has to be proper certification and training of workers, and dignified working conditions, proper labor laws and appropriate pay, and standardization of their work, and provision of PPE and its regulation, and creating worker unions and gender mainstreaming. So with this, I would like to thank you for joining the quiz, and I will hand over back to Raman to proceed with the session.
Yeah. All right. I'm seeing Depinder's comment. What is important to see the marginal views and responses, not the majority responses. Okay. Right. So, now, because we are slightly going behind schedule now, so let me introduce Ava. Ava will be now talking about health, safety, and dignity of sanitation workers. And an initial assessment was done in 2019 between various organizations, Worldbank, WHO, WaterAid, and all. So, Ndeye Diagne is a water supply and sanitation specialist at the World Bank, where she is responsible for water supply and sanitation investment projects in Ethiopia, Nigeria, Liberia, and Sierra Leone. And also she is on the global sanitation agenda. So Ava, over to you, and I'm just putting up the slide. Just give me a minute.
Thanks, Raman.
Coming?
Yes, we're able to see the slide.
All right,
Thank
go
you.
ahead, please.
Yes, good morning, everyone. Good afternoon, good evening. I hope you are all safe. As Raman said, I will give you a quick introduction on the initial assessment that we conducted last year with ILO, WHO, and WaterAid. Next slide. So most of the time in the sector, when we talk about challenges of sanitation, these are images that usually come to mind. The fact that as professionals, we are designing projects and programs to provide sanitation to everybody, especially the unserved and the underserved. Next slide. And the SDGs have introduced a step change from the MDGs, where our objectives as professionals is to provide safely managed sanitation to everyone, especially the billions of people worldwide who still don't have access to it. Next slide. So less often in our projects and programs do we think about these people. The men and women who provide an essential service, and often at the cost of their safety, their dignity, and their health, as well as their living conditions. Sanitation workers are the most vulnerable of workers. They are often unquantified, invisible, and ostracized. Next slide. So jointly with WaterAid, WHO, and ILO last year, we undertook an initial assessment to try to understand what are these challenges, but also try to raise the profile of this issue. We conducted desk reviews and key informant interviews to understand the challenges that sanitation workers face, to present examples of good practices, approaches, policies, regulations, standards that are aiming at improving the working conditions of sanitation workers. We try to also determine what are the existing gaps for future initiatives, but also identify areas of action that we could undertake right now as a concerted effort to improve the working condition of sanitation workers. So the report only focuses on sanitation workers who empty and transport fecal waste from pits and septic tanks, who maintain sewers and manholes, and who also operate pumping stations and treatment plants. Next slide. So the report was launched on World Toilet Day last year, along with an exhibition in Geneva. And some of the pictures you will see in the reports were interviews of sanitation workers that we undertook and that were part of this exhibition. Our objective was to present the exhibition as SIWI, but it didn't happen. So hopefully in the future, when we meet again, we could present to you this exhibition. Next slide. All right, so what are the findings of the report? So we undertook case studies in 9 countries: Bangladesh, Bolivia, Burkina Faso, Haiti, India, Kenya, Senegal, South Africa, and Uganda. And we tried to understand what are the common challenges that we find, what are the good practices also that we find, and then some areas and recommended some areas for action. So in terms of challenges, we find that sanitation workers often suffer from weak legal protection, either due to the fact that they're working informally or the lack of occupational and health standards, but also the weak agency to really demand their rights. So they are also exposed to occupational and environmental hazards as they work in close or direct contact with fecal waste or wastewater. Or they're working in confined spaces with no PPE, and they risk injury, they risk diseases, mental health issues, and often death. Financial insecurity is also a reality for many of them, as they are often poorly paid, and income can be very unpredictable. One other issue is that we noted was people saying that they were paid in kind rather than money, or a different fee that was initially negotiated. So one aspect also of sanitation work is that they face a lot of stigma and discrimination due to the nature of their work. Some of them even have to hide their identity or work in different places so that they can protect their families. However, we identified good practices. One of them is to acknowledge and formalize the sanitation workforce, including legal protection and also benefits. mitigating occupational health risks for the sanitation workers by improving management practice, technology, and also worker behavior. Safeguarding sanitation workers' health by providing vaccination, health insurance, and also health checkups. Standard operating procedures and guidelines, and regular monitoring of the work and the behavior of sanitation workers to support their implementation. And these guidelines at SOP should also include manual workers, as they are the most vulnerable ones. Workers' empowerment, because by promoting unions and associations, we give them a voice for them to speak for themselves. Areas of action. We need to reform policies and legislations and regulations so that they acknowledge and professionalize sanitation workforce along the entire sanitation service chain. We also need to develop and adopt operational guidelines so that we assess the occupational risk of all types of sanitation work, including national guidelines and municipal level oversight. We also need to build the evidence base so that we address the issues of quantification of the workforce, but also further document their challenges so that good practices also can be introduced. And also, we need to advocate for sanitation workers and promote their empowerment. We need to amplify their voice so that they can also speak up about their plight. Next slide. So as a working group, for us, this is more than a report. We really, what we tried to build was strong partnerships so that we create a movement for change, putting the workers at the center of this movement. Whether in the development of the report or the conferences and the workshop that we organize, we really try to have the workers there so that they can speak up about their own experiences, and also how to make their work life better. We would like to operationalize the good practices in our work, and this we'll come back to you on how we're aiming to do it in our different organizations. And also we're about to embark on the second phase of this work, where the knowledge gaps that we identify in the report, we will try to fill them. So stay tuned. We'll keep you all posted about that. Next slide. So the picture you see on this slide is from the sanitation workers' strike in Memphis, Tennessee, in 1968. Back then, Dr. King said something that was very important. He said, "Our society will come to respect the sanitation worker. It is to survive, because for the person who picks up our garbage, in the final analysis, is as significant as the physician. For if he doesn't do his job, diseases are rampant." So 52 years later, and we are all stuck at home during this pandemic, we need to bear in mind that there are men and women out there who risk their health so that to undertake also an essential service, so that every one of us has a clean environment and also is healthy. Thank you all for your attention.
Thank you, Ava. It was a very important presentation. So I request all, listening to Ava and also going to listen to the other couple of presentations. If you have any questions, you can please put them in the chat box. And I also request everyone, when the presenter is speaking, I would request all the others to keep their mics muted, so that it's not disturbing the broader process for everyone. So this is a request for all of you. There was some disturbance coming, during the presentation made by Ava. Now let me introduce Kanika. Kanika is from WaterAid India. Kanika Singh. She leads the sanitation policy initiatives of WaterAid India, and specifically she leads the work on sanitation workers and women manual scavengers. So she is going to present a recent study that WaterAid and Urban Management Center did in India about the health, safety, social security challenges of the sanitation workers in India during the COVID-19 pandemic. So, Kanika, over to you for a quick presentation.
Thanks, Raman. Are the slides for the presentation on?
Yeah, I'm just doing that.
Okay.
Yes.
Okay. Hello, everyone. So, as Raman said, I'll be sharing some very key highlights from the rapid study which WaterAid India and Urban Management Center had undertaken. We can share the detailed findings with you separately. Can we go to the next one? Okay, so just a quick overview of the methodology. So this was a rapid study we did around the last week of May and in like the first week of June. So this was the time when the lockdown in India was on, and it was partly being relaxed in some of the places. In our study, we covered a sample of 95 sanitation workers and 12 urban local body officials, and the interviews we conducted were a mix of telephonic and face-to-face interviews. And most of the study locations were intervention areas of WaterAid or Urban Management Center. Apart from the interviews, we also did a secondary review of various guidelines and advisories of the government, national and state governments, as well as various media reports. The table here shows the different kinds of sanitation worker categories we covered in our study. So these include various categories of work across the sanitation value chain, people who are dealing with solid waste as well as liquid waste. So it includes domestic waste collection, people who are into desludging of sewers, septic tanks, etc., drain cleaning. Then also we also covered some different kinds of settings, such as workers who are working in hospitals and quarantine centers, and also in community and public toilets. So our aim was to cover all the categories of workers, but due to various challenges of the lockdown and also the difficulties we faced in reaching out to some of the informal workers at that time, we could not cover all the categories of workers in equal proportion. Next, please. So starting with the key findings, the first thing we looked at was what are the kind of safety and preventive measures for COVID available at the workplace for various workers, and how are these measures being practiced. So the first thing was awareness on various preventive measures among the workers. So we saw that more than 80% of workers were aware about at least two symptoms of COVID, and also majority were aware of at least one preventive measure. Mask use was mentioned by most workers, followed by hand washing and physical distancing. Um, we also saw that although there were some constraints due to the physical distance, due to which the conventional training sessions could not be conducted by the authorities, but different kinds of approaches, such as online training or training in smaller groups, or uh, design of videos and dissemination through WhatsApp, were being adopted by the urban local bodies. But we also found that some areas which are also critical, such as the reuse and disposal of personal protective equipment and handling and disposal of waste, were not getting so much of emphasis. And we think that these are some areas which need to also figure in various awareness generation measures for sanitation workers. Next, we looked at the access to personal protective equipment and its use. The major finding here was that for most of the workers, the specific personal protective equipment required, as per the nature of work and the type of risk involved, was not available for most, including hospital sanitation workers, who are among the most vulnerable in the current COVID context. Also, in many cases, the lack of user-friendly equipment was leading to irregular usage. So we came across many issues, such as sweating and the feeling of suffocation and discomfort due to heat, improper size or grip which the workers were facing. And we also found that in some cases, the PPE provided by employers was not adequate, and many workers had to then arrange masks or gloves, etc., on their own. Coming to hand hygiene practices, we saw that 40% workers lacked access to a hand washing station with water and soap at places of their work. Now, these included workers who are supposed to travel to different locations in a single day, for example, sewer cleaners or waste pickers, etc. And we also noticed that while most workers were washing or sanitizing their hands at least twice during their workday, but they were not doing so at all the critical times necessary for COVID prevention, such as handling of waste, touching various surfaces, and disposal of used PPE, etc. Now, coming to medical examination or testing, we saw that less than 20% of the sanitation workers across our study locations uh, reported some sort of thermal screening or medical checkup, while the rest were excluded. And within this 20% also, most of them were the workers who were permanent staff or were contractual staff, and the people in the informal workforce were not being covered under such provisions. Next, please. Coming to the livelihood and financial implications due to the COVID pandemic, we saw that 13% workers in our sample were completely out of work since the lockdown had started, and most severely affected were the two categories of workers who were dry latrine cleaners and rag pickers. So, and what is also notable here was that most of these are informal workers, and many of these who were out of work were actually women. So they were facing some additional vulnerabilities. And overall, in our sample, we saw that income had reduced for 30% of the workers in our sample. 20% workers reported that their payments were being delayed since lockdown had started. Around 40% workers were facing challenges in meeting various day-to-day necessities and requirements. And 28% workers had to depend on borrowing money or taking groceries on credit in order to deal with their financial constraints and the situation. So all these led to a severe financial constraint and hunger amongst some of these workers. And as we see, there's a quote here by a dry latrine cleaner which says, "Hunger is more dangerous than coronavirus." So that was something very concerning. Next, please. Coming to the social security and other support measures, so we looked at the insurance coverage amongst the sanitation workers. So only 35% of our sample had some sort of insurance coverage. What is notable here is that all the informal workers were excluded from coverage. And also, if we compare the coverage amongst male and female workers, so the male workers around 42% were covered, and only 22% of the female workers had some sort of insurance cover. So there was some inequity in that sense also. We also looked at some COVID-related support measures which were offered by various agencies. So the first was the general welfare measures by the government for all citizens who are below the poverty line or who were affected by the pandemic. So there were some schemes for cash assistance and grocery support by the national and state governments. Apart from this, some states and cities in our study locations had also introduced some specific provisions for sanitation workers, which included things like monthly financial incentives, cash assistance, grocery support, paid leave, and compensation for those who were infected. But again, what is important here is that informal workers, although they were eligible for the general welfare measures of the government, but they were not being covered under the specific provisions for sanitation workers, which were introduced by the urban local bodies, because most of these were meant specifically for the permanent and contractual staff who were engaged by the authorities and not the informal workers. Apart from this, 23% workers in our sample also received some sort of support from local NGOs, CSOs, and volunteer groups. Next, please. So in our study, we also came across some additional challenges which the female sanitation workers were facing. So the first and very important finding is that women's representation was higher among the informal workforce as compared to men. So that meant that they not only were they badly affected by the livelihood and financial implications of the COVID pandemic, but otherwise in general, they had lower coverage when it came to various work benefits, insurance coverage, and other support measures by their employers. Uh, the study also gave us some insights about how female workers were facing additional difficulties during menstruation, since in many places the public toilets were closed due to lockdown, and some of them were facing a discomfort during their commute and also due to the increased workload during these days. Uh, Also, some women mentioned the additional workload leading to difficulties for them in managing their household responsibilities and taking care of children. So these were some of the things which came up specifically for female sanitation workers. Since the study was a rapid one and with a limited scope, we could not go into much detail into this, but one reflection we had was that the gender lens is something to be looked at within the whole population of sanitation workers who are vulnerable. Female sanitation workers is is a even more vulnerable subgroup, and we think that this lens should be included in various programs, policies, research, and advocacy initiatives which are undertaken for sanitation workers. Next, please. Can you go to the next one? Yeah. This is a case study. Like we have compiled a series of initiatives which were undertaken by various agencies in one of our study locations in Telangana state. So as we can see that there were some initiatives by the urban local body which included various safety measures like provision of PPE, hand sanitizers, and on-the-job training, and also some support like cooked meals provided to workers, etc. And then there were some state government initiatives which included additional monthly incentive and exposure to best practices for the urban local body officials, which were so these were state government initiatives which were also being implemented in this particular location. And apart from that, we also saw that there were some initiatives by NGOs. So UMC, who is the partner for the study, and Samhita, they had introduced an initiative for cash assistance for the informal sanitation workers who are not getting covered under the other provisions by government. So there were some special efforts to help them. Can you go to the previous slide? Okay, so coming to the recommendations and way forward, so we'll not be able to cover all the recommendations in detail, but this is just a snapshot of our recommendations. So these include the immediate health and safety measures which need to be implemented in the COVID context, such as functional hand washing stations and hand sanitizers for all, provision of PPE, adequate arrangements for safe handling and disposal of waste, training, and regular medical checkup, etc. So apart from these, we also recommend social and financial protection measures for sanitation workers, which include insurance coverage for all, and as well as special support for informal workers who do not, yeah, for informal workers who do not usually get covered under the most of the government schemes. Apart from that, the study, although the focus was on COVID-related challenges, but the study also gave us some insights about the long-term systemic measures which could be undertaken. So some of these are listed here. These include more R&D on comfortable or user-friendly PPE for different categories of sanitation workers, and introduction of specifications and standards of PPE based on these. Formalization of work arrangements is also something very important. So this can be done with model contracts and SOPs in place. And lastly, a complete mechanization of sanitation work is very important. But at the same time, while we are going for mechanization, the focus should be also on protecting the livelihoods of sanitation worker communities by making them service providers and equipment owners rather than just the machine operators. So next, please. Okay, so thanks. If in case you have any more queries, you can get in touch with us. Our email IDs are listed here. I think Prerna is also here in the webinar today, so we'll be happy to share more details and information on this subject. And just taking this opportunity to also inform about a global webinar which is going to happen on the 3rd of September, 11:30 European Standard Time. So this is on the safety and well-being of sanitation workers during COVID-19 in South Asia. And some of our colleagues will be presenting findings from Nepal, Pakistan, Bangladesh, and India. I can share the link, the Zoom link for this webinar in the chat box. So if anyone is interested, you can join us for this. Thank you, Raman, over to you.
Thank you, Kanika. And, so I can now take 3 questions, from, if I can see some hands, then 3 questions I can take.
Raman, I think there's a question on the chat box from Janet. Well, I could read it out. Any good ideas for providing hand washing facilities for workers who move between different sites throughout the day?
Kanika, you want to pick up that question?
Sure, Raman. So, while this is a very challenging area, but we were thinking possible solutions which can be taken up for this. So, one of the things is to have some small, simple hand washing stations in the vehicles of the sanitation workers. So, the municipality vans can have some provisions for that, and we have also experimented with some models for such kind of hand washing stations in some of our intervention areas, so which are very simple and easy to install models. So we can share more details about that. Another possible ways to provide hand sanitizers to all the workers, which is very important. And also, wherever possible, if the work site of some workers are fixed, as if, for example, a sweeper who is supposed to visit the same number of sites every day. So some hand washing stations can be installed in those areas. And we also recommended that in some areas where workers are going to residential areas, so the resident welfare associations can also put in place some hand washing stations for them.
Thanks, Kanika. I hope, Janet, your question is. So we have two more questions. We have time for two more questions. If you are putting in your questions, we can take them.
I see another question on the chat box from Vicky, who asks, for enclosed tanks with image opening only, how does one improve airflow or exhaust for workers inside?
Okay, Ava, would you like to pick up this question? This is related to the presentation that you made.
So in the report, we did not provide any
Not audible. There's some problem in the volume side.
Can you hear me?
There's a lot of echo, Eva.
You hear me better?
Yes, perfect.
Yeah, I have to switch to my phone. So now I was saying that in the report, we did not provide technology recommendation. This is in our second phase of this work that we just started. So hopefully we can share with everyone what type of technology we find for specific working conditions.
There's also a response in the chat from Danilo Padilla saying that we could use renewable energy and emptying tasks can be technified, or the entire system can be changed based on that. I also saw a comment from Deependra, maybe Kanika, you would want to respond to it, that he mentions that the first challenge we faced was lack of information on city and state level on how many sanitation workers are enrolled and either contractual or permanent, and the information gap does exist. So do you have anything to say?
Kanika?
There was some connectivity issue. So yes, Deepinder, we also during our study we faced this challenge, and because we were relying on our local contacts and also the city and town authorities to give us contacts of the sanitation workers. So there we faced that kind of challenge because that data was not existing, and especially the reaching out to informal workers was the most challenging because there is no such database currently for these categories.
Okay. So thanks. I don't see any further questions coming, and also our time is exactly, we have reached the kind of 5 minutes delay now. So we need to little rush. So I'm now moving into the next item of our webinar today, which is about we initially planned, as I said during the opening, we initially planned to have a breakout group discussion on 3 topics. But currently we will be going into somewhat similar, but because the technologically the feasibilities are limited, what we are going to do is using the Mentimeter, which we use for the quiz that Shobana initially introduced. So we will be using the same method for discussing 3 topics. So I'm just presenting the slides again, wherein the codes are one second. Yeah, so I'm presenting the slides again. Please. Okay. Yeah. So is my screen visible now?
Yes, it's visible.
Yeah. So 3 groups we have, and you can see the codes for all the. So you please open www.menti.com in your phone, and whichever group you want to join, whether it is policy, regulation, and standard operating procedures, those people may enter the code 6290658. And research and evidence, please go to this menti.com and enter 8553941. And advocacy and empowerment, those who are interested to join that group, please go to menti.com and enter 7146968. So once you enter, one of us will be there to guide you through the questions. And in a 15 minutes time, we will finish this exercise and come back to the main session. So I hope every one of you have entered your choice, and we are now going to specifically take you through the Mentimeter questions on various groups.
I'll just give them 20 more seconds so that they're able to log in and type the code.
Yeah.
If you're facing any difficulties, please let us know through the chat box, and we'd be able to help or solve the issue. They want the codes again. Raman, could you please project them?
Sure, I'll do that. Is it visible?
Yes.
Please note down the codes, and you can be whichever group you prefer to be there, and you can enter the code accordingly, and the questions will be different for different groups. That is something to be noted. So if your interest area and your work area is something that whichever area you can better contribute, please go into that group. Can we now go into?
Yes, I think we can start.
Okay. All right.
So we have some answers in the advocacy and empowerment group already.
Yes, and in the research and evidence as well.
Raman, there are a few people looking for the codes again, including myself. I accidentally exited out of Mentimeter.
No? Do I need to move the screen, or it'll automatically move?
No, it doesn't move automatically.
But it is not moving in my screen. Yeah, it has gone. Yeah, right.
Well, we can post the.
Yeah. It is going now.
For those who just joined, you would just need to go to www.menti.com, and then the codes are on the chat. So for the advocacy group, we are through with all the questions, but I'm going to go through the questions again in case people would like to join.
I'm also going to do the same with the policy and regulation SOP, that group. We are also through with the questions. I'm going to go again with that.
So we'll give 1 more minute
Yeah.
until we close the.
All right. So I think all the three groups would have completed the job. And let me now. Okay. So, Ava, is the group work is over there?
Yes, we're done.
All right. So thanks everyone for actively participating in this process. Now, I'm very glad to introduce two colleagues from the Fecal Sludge Management Global Alliance, FSM Alliance. And FSM Alliance is the member-based network to support organizations and individuals working on the fecal sludge management issues. And the goal of FSM Alliance is to create collaborative, responsive, and collective platform to advocate for adoption and implementation of the FSM as a utility service. And the FSM Alliance is also the new host for the FSM conference. We know the FSM 5 conference and the FSM 6 is about to be announced as well. Submissions are going on. So I'm happy that Jennifer Williams, who is the Executive Director of the FSM Alliance, is with us. Jennifer, welcome to you. And also we have Jan Heinig, is Program Coordinator of the FSM Alliance. Jan is involved in organizing next year's FSM 6 conference and responsible for developing the FSMA membership program. So he's expecting to, we are expecting to launch this membership program maybe during the fall this year, and hands-on member benefits and excellent networking opportunities are expected as part of that. And so I'm now inviting both Jan and Jennifer. Jan will initially take us through what kind of summary of this 3 breakout questionnaire that we all dealt with in the Mentimeter. So Jan will give us a quick highlights of what each group was thinking and what is the kind of, we cannot say the result, but what kind of thinking that is coming out of this group of close to 60 people here. Yeah.
Yes.
Over to you, Jan.
Roman. Thank you, Roman, for the introduction. Pleasure to be here and to be a part of this session. As you mentioned, we're currently working on FSM 6, but also on our membership program, which we will be launching later this year. And the FSMA membership will provide a platform for all stakeholders of the sector, but a special focus will indeed be like on those sanitation workers who actually do the heavy lifting on the front lines, and we're aiming to really help improving their work environments and livelihoods. While we're currently kind of like finalizing our member benefits, it's extremely helpful to be a part of this discussion, of this session, and of the discourse overall, and to see what the needs actually are. I therefore also want to thank the speakers, Awa and Kanika, for the great presentations. There were so many great points there, both about the general situation of the sanitation workers, but then also with regards to the specific challenges posed to them at the moment through the COVID pandemic. Also, like in the quiz that Shobana moderated, there was already, we already got a sense of like some major themes and what the room thinks and feels about the topic, but I'm now really curious to see what came out in the breakout groups. So let's have a look at what was discussed. I think we start with policy regulation and standard operating procedures. I haven't seen the results yet, so I'm kind of like looking at them right now, trying to synthesize a bit, like some learnings out of them. Shobana, will you bring them up?
Yes, Jan, I can project them.
Awesome.
So the first presentation was on regulation and policy, the breakout group. So I will just project it now so that you're able to view it. Are you able to see the screen now?
Yeah, it's coming up. I see the starting slide, policy, regulation, and standard operating procedures. Can you scroll down? So which countries are actually represented in the chat or in this webinar? Indonesia seems to have a lot of representation, and Zambia. I don't see any more countries. I'm pretty sure we must have more countries. But maybe, well, people still had problems joining the Menti. Maybe they started with another slide. So let's switch to the next one. How would you rate the policy environment for sanitation workers in your country? A pretty mixed feeling. I think we're still in the starting phase where not all people were on the platform. So we have one poor, one good, one moderate. Next one. How is the sanitation work regulated in your country in terms of ensuring health, safety, social security, and dignity of sanitation workers? Still, it looks like maybe more people chose the other groups. So it's also pretty even distribution. So let's have a look at the next one. What's the level of political commitment for sanitation workers in your country? It's also pretty much all in the middle, just a moderate or even like a poor commitment towards the sanitation workers. Has your country introduced adequate standard operating procedures for various areas where sanitation workers are engaged? To some extent, not at all. Also, quite a skeptical picture of the situation, but also only 2 respondents yet. How adequately are the sanitation workers paid in your country? Pretty poorly paid, it looks, or going to moderately paid in at least one country. Next one. So what are the specifics with regards to the current COVID-19 situation? Apparently there are some safety measures existent or to some extent, but it looks like it could be more that could be done in this special regard. Next one. 2 important policy regulatory priorities for your country. Just reading them. So to summarize this, it looks like, okay, there needs to be more formal recognition. Working standards need to be established. Yes, and really the formalization of the business of the business services, that seems to be an important point to everyone. But also more interest from the public agencies for the situation of the sanitation workforce. Next one.
I'm going to the next topic now.
Okay. Next one was research and evidence.
Exactly. So.
We've seen some great studies from Awa and Kanika already, but be interesting to see where you feel where the gaps are, where more research and evidence is needed.
Yes. So the screen should be visible now.
It's coming. Starting slide. Let's just dive right in. First question. Countries. We have a global citizen, but then there are participants from Nigeria, India, Kenya, Ghana, South Asia, Honduras. So pretty good representation. Next one. How would you rate the level of information we have on sanitation workers? And it looks like most of you think that there are a lot of data gaps that we need to fill. Let's see what they are in the next slides. So what are the data gaps? Oh, there's a lot of information. Technologies I see in the middle. Service delivery, I guess that also means business models. Best practices, more workers, better conditions, formalized arrangements, and empowering the workers, but also protective equipment. Oh wow, there are loads of replies here. Raise the profile of the issue. That's actually part of the next working group, of the advocacy group, to see that there's some need there. Basically to raise the whole reputation of the sector. understanding the problem that exists. So apparently there is a gap of actually there is no, people are not actually sensitized for the topic, it seems. So actually the whole topic needs to be raised to another level of recognition publicly. That's how I would summarize this. What's the primordial research questions we need to answer related to the plight of sanitation workers? Ask about their well-being. So like including the sanitation workers themselves in the process and in the research is important, but also how we can finance their work. What are the business models? What are the formal standards that need to be in place to actually, change or like improve their working conditions and livelihoods? So what can be done both on a systems level, but also on a personal level for the sanitation workers? Can we yeah, okay. Now, next one.
It's the next question already.
All right. What's the best way to document and disseminate information related to sanitation workers? Obviously, we should go online for that a lot, use the internet, put up videos, but also best practice report, case studies, groundwork surveys, create research networks, use social media. So there seem to be a lot of tools that that people can imagine using to raise the sanitation workers' profiles. Next.
I'll move on to the next topic.
Yeah. We have
Okay.
already it is we only have some minutes left, so let us rush.
Okay, super speed up and then pass it on to Jennifer. Should we take a look at the last one?
Yes, in a second. So you should be able to see this.
We see the main presentation at the moment. So. Or I'm not sure, Shobana, if we can.
Yeah.
Okay, there it is. Advocacy and empowerment. Really quickly, which countries do we have represented? Uganda, Ghana, Puerto Rico, South Africa, USA. Pretty good representation. Next slide. Do sanitation workers receive adequate training in your country? Not really, or only partially. Next. Are there initiatives launched by the government to promote the welfare of sanitation workers? Just a few, or if they do, that is not known. And in some countries, there are quite many. What, according to you, are the strongest tools to promote empowerment and remove taboos? We need to, it looks like we need to use mass media, but most of all, the government needs to buy in to the problem and get active. Next one. How can we provide recognition to sanitation workers? Quite a lot in there. Unions, demystification campaigns, that sounds interesting. Skills challenges, media outreach, and formalizing and institutionalizing their work. Great.
Oh, I'm sorry.
Do you think that the personal protective equipment elevates the image of workers apart from protecting them? And most of you think that yes, it does. So it would be great to provide that to as many workers as possible. Should ground practitioners be better represented in policy and technical conference? Yes, they should. Easy answer. Next.
We're done with the...
Great. Then we only have 1 more minute. Terribly sorry for running over, but I pass it on to Jennifer straight away. Thank you, everyone.
Raman, could you please project the PPT?
I'm just doing that.
Slides. Yeah.
Just. Is it coming?
Jennifer, we're not able to hear you. You're on mute.
Sorry.
Jennifer, you can go.
Okay, thank you so much. Thank you, Jan, for summarizing the findings from the breakout session, and to all of the session organizers. I think it's great to see the momentum around this topic and this particular stakeholder group. Just wanted to say hello to all of our Indonesian colleagues joining us, since on one of Jan's report outs, it seemed there are quite a few people from Indonesia here. As Raman mentioned at the beginning of the session, FSM 6 will take place the 31st of May to the 4th of June in 2021. It's scheduled to be in Jakarta, Indonesia, and we are still remaining hopeful that it will be able to take place as planned, but we are, of course, building an in-depth contingency plan in the event that it is not, and monitoring everything very, very closely. The abstract submission date has been extended until August 31st. So if you missed the initial cutoff deadline, I have great news for you. You still have time. So you have until the 31st of August, close of business Pacific time. So for those of you on the other parts of the world, you have a little bit more time. And then I'll just quickly just summarize. Like I said, it's great to see so much attention finally being paid to this important stakeholder group. I think sanitation workers have been marginalized or even threatened in some countries for far too long for carrying out this critical work. And we at the FSM Alliance in particular recognize the importance for the sector to find new ways to help better support them, so that they can help continue to provide services to communities who likely wouldn't receive sanitation services otherwise. So we feel like this sanitation workers are really the heroes of the FSM sector, and want to continue the discussion on how we can support them. They are the ones who are actually delivering inclusive sanitation. And if we're serious about citywide inclusive sanitation, then I think that we need to really look at the practical solutions, how we can best support them. So it was great to see some of the steps that have been taken in India to support sanitation workers during this time. But I think it also showed us again the gender gap, that women are disproportionately affected in this sector, and especially during COVID-19. So with that, I'll just wrap up. Thank everyone for joining. We hope to see you at FSM 6. Hope you enjoy the rest of the SuSanA sessions that are happening this week. And also, if any of you are going to join any of the Stockholm World Water Week sessions at home next week.
Thank you. Thanks everyone who joined and supported this initiative. Thank you.
I would just quickly like to announce that we have a continuation of the session during World Water Week next week. I'll post the link on the chat. Maybe Raman, you could also share the next slide. Where it's the same session basically, but with probably more different discussions and more information in the presentations during the World Water Week. So thank you for joining us. And I will post the link on the chat.
Thank you, Shobana. Thanks,
Great.
Ava, and all the people who worked behind the session and joined the session.
Yeah, the session is recorded, so we will have it posted on the SuSanA website, and all the presentations would also be available there. Thank you, everyone.
Thank you.
Thank you.